Can you just walk us through what the relationship has been like with the state of Michigan, with the governor's office when it comes to this COVID-19 response?
Yeah, so we've had a very strong relationship with the state of Michigan, starting with Governor Gretchen Whitmer, who I have talked to on the phone and texted several times since the COVID-19 response began, to the senior staff in her office, her chief operating officer, Colonel Gasper with the Michigan State Police, and Major Emmett McGowan, the leadership of the Emergency Management and Homeland Security Division for the state of Michigan. We are in touch on almost a daily basis. We have a close working relationship with them. They're identifying the needs that are occurring throughout the state that they are not able to meet. And from there, they work with us to help source critical equipment, supplies, and anything that they may need in response to COVID-19.
What are those critical supplies? I know initially we've been talking about ventilators, we've been talking about N95 masks. What has the federal government through FEMA been able to provide to the state so far?
So far we have provided millions of pieces of PPE, over 4 million N95 masks, millions of gloves, millions of gowns, other protective personal protective equipment that is needed for frontline healthcare workers and public safety professionals. We've also heard their need for ventilators, and over the last several weeks have deployed hundreds of ventilators to the state of Michigan. We've also looked at their potential hospital capacity issues based on projected cases and a projected surge of COVID-19 patients. And we have taken on the efforts of converting the TCF Center into an alternate care facility, as well as the Showplace Convention Center in Novi, Michigan, to ensure that the citizens of Michigan have every hospital capacity need that may arise as it relates to COVID-19.
Administrator in New York was basically the first with the Javits Center to do such a thing as what you did here with TCF Center. We just saw the USS Comfort leaving New York. How long do you see TCF Center being used in this fashion?
So right now we have the TCF Center that has patients there. We really need to continue to work with the state of Michigan, and we are, on assessing what the needs are. As we've seen the curve start to flatten, if you will, or start to level out, there is less of a demand for hospitals that are in the area, for hospital beds and ICU beds. So that could correlate to a drop in demand for the TCF Center. However, we don't want to take our foot off the gas. We don't know what the next several months could hold as far as a resurgence in cases or an additional increase in cases. So it's a very clinical decision that we need to make with our Health and Human Service partners and the Michigan Department of Health and Human Services, kind of an ongoing daily assessment before we can claim total success and close down the TCF Center.
Can you share with us how many patients are at TCF Center right now and how many are at Showplace?
I believe at current count there were 16 patients at the TCF Center. I don't believe there are any at Showplace yet. That facility is still kind of getting built up to speed for the needs in that immediate area. But at the TCF Center, there are 16 patients as of this morning.
Administrator, you've been at this for a while now. I know you've seen a lot of disaster, a lot of situations that FEMA has had to respond to. How does this stack up?
Well, I think this is truly unprecedented. Never before has any state had to deal with an emergency in every single one of their counties or every single one of their communities. And never before has the nation had to deal with a disaster of this scale across all 50 states, across all of our territories, and across 571 tribal nations. So this has been unprecedented. Have there been challenges at every level? Yes, there have, but together we have been able to overcome those challenges. This is not just the federal government responding or state and local government responding. This truly has been the whole of America, because every individual citizen has been doing their part to stay home, to follow the stay-at-home orders, to practice social distancing, and that has been the major contributor to us seeing a decline in cases because people are staying at home, and we're seeing that mitigation works.
Administrator, I know that there was a lot of discussion about the response in the early stages of this pandemic. It seems that that conversation has shifted a little bit, that because of FEMA providing those N95 masks and other PPE, that we are in a better place than we were a month ago. But there's also reports I want you to respond to, if you can, of some shipments of N95 masks that have been taken from FEMA that were supposed to come here to Michigan and to Delaware. Are you able to walk us through and give us some insight into what's happening there?
Yes, I've been working very closely with the governor's office. I believe it's been 3 or 4 weeks ago now, where they first contacted me about a supplier that said FEMA took their order or redistributed their order. I spoke to the CEO of that company directly. We found out that that was not the case, and we shared that information with the state of Michigan, and they were able to work with their vendor to get additional supplies. And whether they got supplies from their vendor or not, we were able to provide critical supplies to them. Just recently, there was an allegation made by a company that FEMA or HHS took their testing supply order and diverted it. And we spoke to that corporation and found out, no, that was not true. And so now we've connected the CEO of that company to the state of Michigan so they can continue to source the supplies that they need. So there's been a lot of accusations that the federal government is redirecting orders. We are not working in competition with any state. We are working in collaboration with them.
Administrator, the conversation now has seemed to go to testing as we start discussing how to re-engage certain sectors of the economy here in Michigan. What is FEMA's role in providing that testing capacity, not just the tests themselves, but the supplies needed for those tests, the cotton swabs, the reagents, things of that nature, so that we can have wide-scale testing and get back to reopening our economy?
Yeah, so the president unveiled his blueprint for testing just recently, just yesterday. And it's important that we recognize that states have the responsibility because states have the lab network. They have the lab capacity, and they work with the private sector labs and also university labs throughout their states. So as those states continue to identify what their needs are from a swab perspective, from a testing medium, from a reagent perspective, those are all things that we are going to work very closely with them to support. The CDC and the White House and FEMA and HHS, we've had phone calls with every state over the last several days. We will have more calls in the coming days to truly identify their need and help them resource as these supplies become available on the market. And as these manufacturers continue to increase their production, we will ensure, we'll work very closely with those manufacturers to ensure that the states have what they need.
Will FEMA be in the procurement process for antibody testing as that ramps up?
That is something that is being worked at the White House task force level and at HHS. We may assist in some level of procurement for that. You know, the whole of federal government is working together on everything. So wherever support is needed, FEMA is more than glad to support.
What do you see that Michigan still needs right now?
Well, Michigan has done a phenomenal job from the governor's office on down in responding to the situation. They have been using a lot of the science and the data and the clinical fact that they're seeing of what's happening in their state, but it's continuing to work with them. There's going to continue to be PPE needs. While we may not need the TCF Center as a facility, there may be fatigue in the healthcare environment. So we want to ensure that we're working very closely with the state of Michigan to understand what their needs are, and whatever need they have, we'll continue to support.
Anything that I'm missing that you want to make sure that our viewers here know?
Brian, one thing I'd love for you to highlight is I have amazing men and women that work at FEMA, and since March 13th, they've been working 16, 18-hour days, 7 days a week to ensure that states like Michigan and the entire country have what they need. And it's not just FEMA. We have the whole of federal government, multiple agencies working close by with us, hand in hand with us on this response. I want to make sure that they are acknowledged and that they know that I appreciate them, and so does the nation.
Do you see a horizon point where FEMA is no longer needed here in the state?
I think there will be several months ahead as we continue to work in recovery, in response and recovery, and we don't know what the future holds. Science is indicating that there could be a resurgence in the fall or in the winter. So we're not going to take our foot off the gas, Brian. We're going to continue to ensure that we're continuing to plan and be prepared for whatever it is Michigan and our nation needs.
All right. FEMA Administrator James Joseph, thank you for your time.
Brian, thank you, man. I appreciate it.
Yep, take care. Be safe.